But I've asked Dr. Murray Cohen to come back on. Dr. Cohen, good morning. How are you?
I'm very well, Ken. Thank you very much. I'm delighted to talk with you, as always.
And you've always been a valuable source of information to us. I said the other day, a very uncredible radio show. To have somebody with credibility on it is rewarding and gratifying, and we appreciate you doing that. I want to be an antagonist for a little bit this morning, and I've gotten to know you well enough that this doesn't bother you a bit in this world. But I want to go through the last couple or 3 weeks, and one number turns into another number, and you know, we didn't get this right, but we think we got that right. And I heard Scott Gottlieb yesterday or the day before saying the mitigation worked, probably not as well as we thought the mitigation would work. In the beginning, people like me trusted. I dare say people like you. But now I sense that we're wondering, do we know anything? Is everything a great unknown? This number turns into that number. That number turns into another number. How do we, as people who don't understand the science and methodologies, how do we process all that?
Well, there's a famous saying, you know, I can explain it to you, but I can't understand it for you. I think you were talking about people who trust and don't trust government. We also know there's people who trust and people who don't trust science. And I think what's particularly sad in this country, and this is not the first example with COVID-19, practically every outbreak, which I tend to refer to as CNN-itis, people see something on the national news and they act crazy. You know, an example of that, just to digress a bit, is I remember there was one case of mad cow disease back in the late 90s, cow that was shipped from Hawaii to Canada, Western Canada. That was reported on the news, and over the next 3 weeks, all the hamburger joints were about to shut, and Chick-fil-A did very well. People just react very viscerally to science that they don't understand, rather than try to understand it. And if there's a fault, you know, blame that I point the finger at my colleagues in the world of scientists, it's that, you know, it's almost like they use a vocabulary to try to confuse people rather than trying to explain things in ways that they'll understand. I think if people really understood, back to your question, what have we learned through this devastating period, you know, to our economy as well as to our public health? What have we learned, and how do we now use those lessons to correctly get back to work? Because we have learned a whole lot. And I'll go through in a minute, and I'll give you a chance to react, but I'll go through some of the key points. But I also want to point out the caller right before, I think his name was Matt, gave a really good analogy about a house burning down, and whether you let it burn down or you prolong it by trying to put it out. He missed one very key point, and that's not all viruses, but it is this virus, what we call a highly virulent virus, very communicable, very easy to catch, and merciless in its spread, for whom no one in the human population is innately immune. Everybody is susceptible. This is a case of you go to a fire, and it's more like a wildfire, and it's not going to burn itself out. It's just going to keep burning. And it's going to keep burning and get hotter and wider until it's burned the whole earth. And confronted with that kind of a challenge, you know, we can't do nothing. You know, and I don't think it's a matter of value judgment. You know, do I care more about, you know, people living and dying or people having jobs? I think it's more a matter of doing a risk assessment and coming up with some sense of what's an acceptable risk in order to mitigate the problem. So, you know, we can't put the genie back in the bottle. I can't argue at all with your characterization of where the economy is now. You've you know, hit a bullseye, and it's very sad, and it's frankly very scary. The time for pointing fingers, you know, is in the future. Right now, we still have to beat this thing, because right now it's still beating us.
Let's stop there if you don't mind. We got to take a break. We float these breaks, but I don't want to get too far behind. I want to come back and you tell us kind of a laundry list, I guess, of what we have learned. And then I've got some questions of my own about things that that I was told a month ago that have not exactly played out as we were told. And I'm sure you can explain the reasoning and rationale behind that. Let's do this, Cato. Let's take a break. We'll be back in just a second. Very fortunate to have Dr. Murray Cohen. He is an expert in these sorts of goings on, and he's been kind enough to join us a couple of other times. We didn't offend him so bad that he didn't agree to come back on. We're extremely grateful for that. We'll take a break. Back in just a second.
We're back. This is Wake Up Carolina.
See, we can call this next segment an expert and an opinion monster. Somebody who has an opinion, however ill-informed or properly informed it may be, he has an opinion. And then we have a true expert. Dr. Murray Cohen has been kind enough to join us. He was talking earlier about understanding the economic realities and accepting some of those challenges as real and have to be considered and dealt with. But we do have a virus. Dr. Cohen, I am in no way, shape, or form trained to give an account of what I think we need to do. But as I've read and as I've listened and as I've tried to understand, it appears to me that the virus is never going away and we're going back to work at some point in time. Maybe too quick for some, maybe too slow for others. Do you agree with those two fundamental points? The virus is here forever and we're going to have to go back to work at some point in time.
Absolutely. I think that the key is that because we have learned a lot in 3 months of agony, how do we maximize our use of what we understand and what we know to have the least public health and medical impact from going back to work? Because we have to go back to work. And this is crazy. It's absolutely crazy. And some of the governmental I don't know if it's true in the U.S., but where I live in Central America, it's like martial law. It's totally crazy. And the virus doesn't care. It's going to do what it's going to do. We're not acting according to the way we know the virus will act. And I think the key here, the two most important words that sum up everything we've learned is social distancing. We never had that term before. You were correct when you said, you hadn't heard it and didn't know what it was. We made it up for COVID-19. And it turns out to me to be elegantly simple and brilliant because it covers just about everything we know about the virus when we don't have a treatment and we don't have a vaccine. Specifically, we know this virus is horrible. We know the course of the disease is just horrible. We know the risk factors, people who are over 60 years old, people who have underlying medical conditions, et cetera, et cetera. We know the kinds of medical treatment, the support treatment for patients to try to get their immune system to fight this off. That's all we can do because we can't give them anything to boost their immune system or help fight it off. It's the best we know all of that. We know how it's spread and how it's not spread. And that's really the key to social distancing. There's also hand washing, which is a little part of it, an important part, but, small in terms of number of cases that are actually caused by, touching droplets and then touching your face. Most of the spread comes from inhaling or having breathed upon you the virus from someone who's infected. And we know from at least 2 studies elsewhere in the world that more than half of the cases of infection transmission are from what we call asymptomatic spreaders. These are people whose immune system is so robust that when they are confronted with the virus, their immune system goes into action, and it's like a constant battle, of creating a demilitarized zone, if you will, where your immune system fighting the virus winning, the immune system winning back and forth until finally you win. During that time of the fight, you can be asymptomatic because your body's working. You probably have a low-grade fever. You probably have, a bit of a sore throat, but probably not anything you even notice. Your body's fighting it off and your body wins. But every time you breathe, every time you talk, you are shedding a virus out into the atmosphere. And that's how it spreads. That is fundamentally how it spreads. Now, there's an important technical concept, if I might. and I don't want to get geeky, but I think it's important to understand, to grasp this social distancing concept and this wearing a mask concept. There's a difference between airborne transmission and aerosol transmission. Airborne, think of that as spitting, basically. You're just going across the room. It's in the air, but it's not floating in the air. The virus is in heavy particles that are wet and dense, and they sink and they land on and stick on whatever they hit. Aerosol transmission is when the particles that are breathed out are so tiny that they're like the dust you see in a sunbeam, and they continue to float in the air. And they mostly infect someone else by that person breathing it into their lungs. In the airborne transmission, they mostly infect people not by getting into the lungs, but by simply getting into their nose, mouth, or eyes. So an aerosol transmission disease like influenza is going to primarily replicate in the lungs of someone who's infected, whereas this airborne transmission is going to mostly replicate in the nose and throat. If that makes any sense.
Sure it does.
But here's where the elegant brilliance of social distancing comes in. We know from fairly complicated aerosol physics that airborne particles will only travel about 2 or 3 feet. And then they're going to either stick to something they hit on the way, impact it, or they're going to fall down and stick on something. We know that you can cough, or sneeze violently. And actually, there's one study that was just published out of Massachusetts Institute of Technology that showed it could go as much as 27 feet. I'm not sure I believe it. That sounds like, Olympic world record long jumping or something. But anyway, it can go a lot longer. But again, that's not primarily how this COVID-19 is transmitted. So what social distancing does, putting yourself 6 feet apart, means that those asymptomatic spreaders that are causing half or more of the infection transmission are talking and breathing, but not hitting you. And that's why a mask, even though it's like a surgical mask, or even if it's a scarf or a bandana, if it's a tissue, any barrier to the physical spewing of the virus particles is going to make it go even less. So the idea of wearing a mask, as opposed to a respirator like N95, I'll get that in a second. A mask is what you wear to protect everybody else in case you're infected. It's not going to protect you from anybody else who might be infected. You have to social distance for that. Now, if you're a healthcare worker and you're around high concentrations of lots of people who are infected, coughing all the time, you have to have an N95 respirator. This is like an industrial respirator that you might use for a chemical or a dust in a factory, et cetera. These are designed and made specifically to filter out all of those tiny particles and keep you from breathing them in. That's why it's kind of hard to breathe through those things, because they're filtering it out. So to me, if everybody in America understood this and could decide when they need to wear a mask, when they need to be 6 feet apart, when they might have to wear an N95, then we wouldn't need any of these closures. But people don't do that. And it's too much to expect them to do that.
Let me ask you a question, and I guess this is the politicking of science. I mean, believe it or not, America turns everything into a political story. CNN has a certain iteration. Fox, the New York Times, the Wall Street Journal, everybody covers these numbers and story, and then they create a certain narrative from the numbers and the story. I've tried my best to understand the CDC's accounting. I've gone to their National Center for Health Statistics every single day to try to better understand. And it looks to me like that some of these states, I don't want to say are misrepresenting the number of people who died of COVID-19, but they may not have died of COVID-19, but with COVID-19. Explain, if you will, as somebody who has been inside the belly of that beast called the CDC, how do we, and I guess what I'm not arguing, I'm trying to make a point, and I'm antagonizing a little bit, is that the average number of Americans who die every day is between 75 and 7,700. Dr. Cohen, it looks to me like that's still about the number of Americans who are dying, 75 to 7,700 every single day. We know the outbreak in New York City. We understand the commuter counties of New York City. We understand the dynamic in the nursing homes. But it looks to me like everywhere else in America, per the CDC statistics, people are dying at about the average rate, historical averages, from 13, 14, 15, 16, and 17. How would CDC add credibility to the fact that these people are dying of COVID-19 and not with COVID-19? They've got all these comorbidities, and they're 86 years old. They've had emphysema 12 years. Help us understand what goes into determining whether or not that death is truly a death attributed solely to COVID-19.
Well, this is, I'm only on the fringes of expertise here, but I can explain it to you as I understand it. First of all, it's heavily regulated. There's not a whole lot of discretion given to medical examiners. Some, but not a whole lot. They've got their own manual, if you will, of cause of death, what they call approximate cause of death and a secondary cause of death. And approximate cause of death is, let's say, a lot of these COVID-19 cases are going to die of pneumonia because it totally eats up their lungs. So the approximate cause of death would be pneumonia, and a secondary cause of death would be COVID-19 infection. It'd be the same thing if they have a heart attack, but they happen to also be infected. Now, I haven't looked at the numbers, so I have no reason to doubt what you said. I assume that's correct. I do know that all of our counts are grotesquely undercounted because we have had an abject failure of testing. And by the way, I heard, I think it was on the news, you should be very proud in South Carolina. The approach to antibody testing that MUSC is now launching will make you perhaps first in the world. I mean, I've talked about this on your show before. I've been, carping since the end of January. We need to be doing antibody testing and get an idea of where this virus is. Find people who have been exposed and have responded with antibodies. Then we'd be much better able to identify hot spots and, put certain controls in place, including shutting down businesses or whatever. But we haven't done that. We're starting to do it now for reopening. So at least, it's not too little. Even if it's too late, it's not too little. It's the right thing to be doing. So you can be proud of that. I think at the end of the day, when this is all over, when we look back, we're gonna find that there were a lot more cases than are being reported now because we weren't looking, so we didn't see them. I think another, though, mortality statistic that may be more meaningful as you're looking at NCHS, National Center for Health Statistics, is take a look at like the top 10 causes of death on any given month in the United States or in your state, wherever you're looking for. And what you're going to find is that over the course of 1 month of March, COVID-19 went from unknown to the number one cause of death. So maybe it gets smoothed out and you don't see the blips in a National Center for Health Statistics report of total deaths. What you really want to see is deaths relative to all other causes. And there is no doubt that this thing is killing us. It's a wildfire killing us.
Let me ask you a last question. We got to take a break in a couple of minutes. And once again, I do appreciate your time. I mean that sincerely. As I've tried to understand from listening to people like you, reading articles on either side, those who believe we've overreacted, those who believe we've underreacted, there are those who believe we've done about the right thing at the right time. No matter what your opinion is in regards to that, it seems to me that the biggest component in how we respond is the immune system. I mean, the God-given immune system that each one of us have, at some point in time, it's more likely than not we'll encounter the virus. And we will depend on our immunity, our own personal immune system to defend or not. Is that an overstatement, or is that something that is very much to be considered.
That's exactly right. The problem is that right now our own immune system is all we've got. Now we're pretty close to having some treatments that'll actually kill the virus, not just support the body and its immune system. And when we get a vaccine, what that does is essentially, it boosts it gooses the immune system so that it responds more favorably quicker. So absolutely, it's the immune system. And, this virus is diabolical. It found a way to get into humans, a host that it could ravage. And right now it's worldwide winning.
Dr. Cohen, we appreciate your time, sir. Have a great day. And believe it or not, we may call on you again.
We will, I'm sure.
As this saga continues. But thank you. Stay safe. And you are once again the charter member of the Wake Up Carolina caller and guest Hall of Fame. Thank you, sir.
Thank you so much.
Absolutely. We'll take a break. We'll be back in just a couple of minutes.